Welcome.
Thanks, Jill. I have a home crowd. We live in a time and a place where our world is faced by acute problems: escalating racial tensions, impending climate catastrophe, growing income inequality, populist anti-immigration white supremacist movements, and women's health and rights continue to be under attack. Even here in Canada, where we have seen great strides, women still do not have equality. Working moms make 75 cents on the dollar compared to men. 70% of the people living in poverty in this country are women and girls. 50% of pregnancies in Canada are unintended. 80% of lone parent households are still led by women. 21% of single moms are raising their children in poverty. Half of all women in this country will still experience sexual and physical violence at some point in their lifetime. And Indigenous women are 6 times more likely than non-Indigenous women to be killed. Canada is a wealthy, democratic society with universal health care, and yet we struggle. I've spent over 20 years working in this sector here in Canada, in the United States, and in Southeast Africa. And often when a gap is identified, the charitable sector steps in. The theory of practice for charity is basically this: a donor gives money, tells the charity what they want to see done. The charity does what it can within the limits of its mission and the size of the donation. Charity attaches itself to the problem. Charity is controlled by those who have greater than, and charity fills the gap, but it doesn't ever end. And charity's impact is dependent on continued generosity and loyalty to a problem. When the challenges are immense and the scale is immeasurable and it's international and the roots are embedded in immovable systems, it is safe to say that charity is no longer enough of a response in helping our world achieve equity. We need to move to impact and investment, where those who need the change are the ones affecting it and governing the solutions. And we need to go from relief to transformation. We need to find investors who are willing to back the crazy ideas, take the gambles, and make the sacrifices to help us leapfrog over the systems to real and sustained change. I have changed my approach to my work from facilitating charity to inspiring transformation. Instead of working within a system and trying to change it, I believe we can leap over the gaps that exist and change it from the outside. We will never be able to remedy our world's biggest problems by dabbling in incremental change. Our sector must leapfrog over the noise and create sustained change that ultimately deals with the reasons why people need charity and nonprofit involvement in the first place. Women in Canada do not have equitable access to quality health care. Women tell us they feel dismissed, misunderstood, and they're often told that's natural, it's part of being a woman, or it's all in your head, rather than the system asking, well, let's see why you're experiencing these symptoms. I could spend my time talking about how society is misogynistic and sexist, and that we have a colonized healthcare system, and that everything's been created by men for men with men in mind, all of which is actually true. But it doesn't change the fact that we have been fighting this battle for an incredibly long time, and virtually nothing has changed. So yes, the system is broken, and I actually can't fix the system. So instead, we looked at why women are not being taken seriously, and we found that the most significant opportunity for change was research. Here in Canada, women have only been included in research trials since the 1990s, and we're still not equitably included. The amount dedicated to women's health research is but a fraction of the total that's dedicated in this country. We could argue that one of the reasons women are being dismissed and misdiagnosed is because we actually don't know what we don't know. So we recognized that research was the investment that we needed to make, and so we broadened our organizational mandate in response. And we're now operating with a much broader vision that more deeply invests in women's research. Research represents part of a big solution that solves multiple problems, so that's where we've started. We applied a people-first focus as opposed to a systems-first focus. We will fund women researchers researching women's health issues, where patients and participants are included in the design of that research. And we will fund research that marries story with science, so we can ensure people understand what has been learned, so it can be implemented into policy and practice. Women make up half of our world's population, and we have a responsibility to change the tide on women's health. to invest in the research, to insist that women are included, understood, believed, treated, validated, and healed. Gender plays a role in how healthy our society is, and it plays a role in what kind of health care you receive, and it all starts with research. So let's leapfrog over everything else. You can't unlearn something. So let's invest in learning as much as we can about why bodies are different and why our women's bodies are different, so that worldwide we can benefit from healthy women everywhere, capable of anything. Thank you.
Great, Genesa. Thank you. And thank you for being so generous, sharing what it took to begin this positive change.
Thank you.
You know, you talk a lot about, or I've heard you say a few times, not for us, without us, which is really an important concept. Think about it, and I know you all live it, but think about it in words specifically. Genesa, how big is that gap you're trying to close?
So currently right now in Canada, funding for women-specific health research makes up around 1% of total health research in this country. So it's a pretty substantial gap. And then when you start to add things like, are you an Indigenous woman, are you an older woman, a new immigrant woman, a racialized woman, or a woman living in poverty, we've got a long way to go.
Good luck in getting there. I have no doubt you will.
Thank you.
Thank you. Thank you.